Are you also not happy with the loose skin, the stubborn lower tummy fat, or the stretched out muscles in your tummy post-pregnancy? So friends, in today's video, I'll take you through the journey of two different patients, right from their consultation to their post-operative results, in which they also suffer from the same issues that you have. That is loose skin post-pregnancy, excessive amount of lower fat which will not go away even with the maximum exercise and diet that you can do, and the stretched out muscles or diverification of recti, that is the muscles they get split apart because of your pregnancy issues. Now before we dive into the details, what exactly is a tummy tuck or a lipo-abdominoplasty surgery? So tummy tuck or lipo-abdominoplasty is made up of two different components. One is lipo, that is liposuction. So because in the back where you never had a child, you had the child in the front, so the back skin has not stretched out, but you still have a lot of fat in the back and the flanks. We take out this fat to make your body much slimmer and to give you that hourglass figure, so that the extra amount of fat that is on the flanks and the back is being taken care of with a liposuction surgery. In this we might use VASER, we can use power-assisted liposuction to take out all this fat. So this is the first component, that is liposuction. We'll also be doing liposuction in the upper portion of your tummy and the sides of the tummy in the front. So not only are we removing the extra skin, we are also removing the extra fat. Okay, so liposuction will take care of all the extra fat that is there outside your muscles. Now once that is done, what we do is the second part of the surgery, that is the main tummy tuck or the traditional tummy tuck. In this, what we do is we give a cut which is below the cesarean cut. Okay, it is around 6 centimeters from your introitus, and from there we give a cut all the way to your bones, so both the pubic bones. So the cut is like a C-shaped, it's called a bikini line incision. Now this incision finally will heal very nicely and is always hidden in your panties. It's not very visible. Yeah, in the initial years or in the initial months, it will be visible because as Indians, we are all brown skin. In white colored people or in those who are very fair skinned, the scar will be much less visible. But in anybody who is like me, that is your skin type is 4 or 5, the scar will be a little bit visible initially. But over a period of a year or so, it will become almost imperceptible, and this scar is always hidden. So it is always within your panty line. So this scar will extend right from one bone to another, and this scar is because we'll use this to enter inside your skin. So we'll go beneath your skin. We are not opening your tummy. We are not going inside your organs or anything. We are just beneath your tummy. So we'll make a plane beneath your skin. We'll just pull the extra amount of skin that is there and then stitch it. So this will take care of the extra skin that you have. And the third problem that was there was the split apart muscles. So you must have noticed after your pregnancy, no matter how many crunches you do, no matter what you do for your core muscles, the core muscles do not tighten up in a few females. This is because the muscles which were supposed to be in center have now split apart. Because the baby was growing inside, the pressure of the baby has made your muscles go separate. They have become much wider now. And no matter what you do, they cannot be brought together with an exercise. So what we do is, once we have made a plane between your skin and the muscle, we will now bring back the muscle to your original anatomical position. So what we are trying to do is, we are trying to recreate the muscles in the plane where they were already. So now because of the baby, the muscles have gone apart. We are now bringing them together and closing this shutter. Now once we close the muscles, this problem will be solved, and this is only when you can give a good contour to your sides also. So if in case you have a diverification of recti, this step is added and we stitch the muscles together. And so once we stitch them together, after that we pull the skin properly, and whatever extra skin is there, we'll be cutting them out. So what will happen to the belly button? So these are two different patients. Our patient number 1, she had an umbilical hernia. So during pregnancy, what happened was, the belly button, it popped out, and the contents of the tummy were coming out through her belly button. So this is called as umbilical hernia or belly button hernia. So what we did was, because the belly button was already destroyed, we created a new belly button for her. Okay, so once we pulled the skin down, the belly button we excised, that we removed because it was already gone. So we just removed the skin, and the position where her belly button should be, where it would look good, we just give a cross cut, and all the 4 edges of the cross, they are stitched inside with your muscle to give you a natural appearing belly button. But in our second case, in which this lady her belly button did not pop out, she had a very nice, beautiful belly button. We used her original belly button. So we pulled the skin. Now the belly button is supposed to go down, but we just cut the belly button, transpose or bring it back to the original position, and just stitched her original belly button back to its position. And this is how it is. Now I'll take you through the process in both the ladies. This first lady, as you can see this bulge in the center. This matka shaped bulge that you see in the center is because the muscles are wide apart. You can even see the boundaries of the muscles. It is because the muscles are split apart. Similarly, in the second patient also, you can easily make out that the muscles are wide apart. You can also appreciate there is a lot of extra skin in both the patients, and there is fat even on the back, sides and the front of the tummy. So in both the patients, we did exactly the same surgery except for the belly button, like I explained you before. We took out fat from their back, from the sides as well as from the front. We then stitched their muscles together, and then we took out all the extra skin that they had. And this is how they look immediately after. And for the patient number 1, we made a new belly button, and for the patient number 2, we used their original belly button to give them a more pleasing result. If you have your original belly button, they look much better compared to a artificially made or a neo-umbilicoplasty. Okay, so this is how you look. When we talk about the surgery in both the cases would take somewhere around 4 to 5 hours. It will all depend on how much liposuction we have to do, because liposuction itself might take about 1 to 2 hours if we do it properly using VASER and Power-Assisted Liposuction. Then we turn you again, and then we do the tummy part. And to stitch it properly, it takes almost an hour to stitch the incisions properly. It might take about 4 to 5 hours. We can combine it with your breast lift, breast augmentation, arm liposuction and other stuff which you can discuss. Once the surgery is done, you will have to stay in the hospital. You will have to stay in the hospital for about a day or 2. The recovery will take almost 10 to 12 days, and I advise my patients to take a leave of about 2 weeks from their work. You can start your cardio at about 4 to 6 weeks from the surgery, and you can go back to your normal exercises at about 2 to 3 months. So this will be the whole recovery process after the surgery. I usually recommend you do this surgery after about a year of your family is complete, if you have help at home. And if you don't have help at home, wait till your babies are at least 4 to 5 years so that they don't need your constant supervision, and then you can opt for this surgery. But make sure your family is complete, and then you can opt for this. This is our patient number 1. You can see from the front the belly is much better, from the sides as well as from the back the contour is better. This keeps improving for almost 5 to 6 months, because the edema of the swelling will gradually go down in the period of 3 months. And this is our patient number 2. She was from abroad, so we were only able to take her pictures at about 14 days, after which she went back to her country, and this is how she is. You can see how the tummy has gone back inside. There is still a lot of swelling, but it will go down. And if now you diet and exercise, you can even refine or even make your body better. We cannot make it like a completely scaphoid abdomen, because there is a lot of fat inside your muscles also. What all I can do is I can take care of things which are outside your muscles, and we can take care of your muscles as well. So guys, this is in brief about tummy tuck, and if you have any doubts regarding tummy tuck, you can comment in the section and we will be happy to help you. If you want to have a consultation, you can book your consultation as well. Thank you and have a nice day.